everyone. This is Dr. Paul Griffin from the MARTA, and he's the Director of Infectious Diseases. And today we'll be talking about long COVID. Now, I've been hearing about long COVID for some time, and perhaps the first time I heard of long COVID was from a friend who lives in Germany when it wasn't being talked about in Australia yet. So what is long COVID and what causes long COVID?
Yeah, thanks, and thanks for having me. Look, long COVID is just another example of why we need to do more to try and control this virus. I mean, we hear so much about death and ICU and hospitals, but there's a significant proportion of people that actually have really significant symptoms, many for months after they get infected with COVID. And in terms of the type of symptoms people can have, there's a really big list. For a lot of people, it's things like fatigue, brain fog or not thinking as clearly as normal. It might be a reduced ability to do exercise that people were able to do before, or even some other more specific things, including shortness of breath, cough, and that sort of thing. And there's a lot of different numbers that people quote in terms of how many people have long COVID. Some of the figures are quite astonishing, that maybe even up to things like 40% of people might have some symptoms out to a few months after they have COVID. And one of the main things we need people to understand is if you don't get COVID, you can't have long COVID. So things like mask wearing, being vaccinated are really important. And even if you do get an infection and you're fully vaccinated, the risk of long COVID is then reduced. So it's another really important reason why we should take steps to protect ourselves and people around us.
So I've heard of these new treatments called antivirals. What are those and how can they help us fight long COVID?
Look, we've done a fantastic job of getting the tools to be able to combat this virus. I mean, everyone's aware we had great vaccines and we did those quite quickly without skipping any of the steps to make sure that was safe and effective. And our vaccines actually exceeded our expectations in terms of how well they work, and that continues to be the case. But one thing we were lacking until recently was something we could give to people once they had COVID to reduce their chance of getting sicker and ending up in hospital, etc. And so at the start of this year, we had 2 antiviral medicines that do exactly that. So these are tablets that we can give to people once they test positive, and it really reduces your chance of getting sicker, ending up in hospital and not surviving this infection. So it doesn't replace vaccination, but particularly in someone who's fully vaccinated, really helps reduce the chance of getting sick and keeps people out of hospital. So a tremendous advance in terms of our ability to manage this. And they're a bit hard to get still at the moment, mainly because a lot of people don't know where or how to get them. So I'm encouraging people, particularly if you're high risk, so elderly, or you have some medical problems, to speak to your GP or specialist ahead of time and ask if you might be eligible and find out how you would get those tablets if you get symptoms and test positive.
Great, thank you so much. You answered my last question.